Thank you so much for being here this morning. I'm going to keep this brief. I'm Dr. Judy Sims-Senden. I'm the Director of International Experiences here at the College of Medicine and a big advocate of global health education and service learning for our students. We have a very special morning planned today. I'm going to pass the torch to our medical students. I just want to put out a few thank yous and then I'll turn the show over. I am immensely impressed and proud of the medical students that I've worked with who've put this program together, from the coordination of every room, to the food, to the invitations, to the brochures, to the signage. They have been professional in a profession of PR that doesn't usually come with pre-medical education. So hats off, very strong work. I'm sure it's going to be a very successful conference. Thank you so much to the administration and staff from the College of Medicine. Dr. German, thank you for letting us work with Mary Howard and Joe and Chip and all the people, and Michael and Wendy, our publicist, who backed us up and supported us with resources from the College of Medicine that were invaluable. And thank you, of course, to Dr. German for supporting global health education here at the College of Medicine. Welcome, everybody. I'm going to turn the program over now to Nisha Patel, who is a second-year medical student who is the president of MedPAC, which is our Global Health Students Interest Group. Nisha.
Hi, everyone. So like Dr. Simpson-Dunn said, my name is Nisha Patel, and I'm the executive director of MedPAC, which is the global health group here at UCF, and we're the ones that kind of put together this conference. So first of all, I'd like to thank you all for coming out this morning, especially those of you that came from out of state. I know it was a long trip drive and it was kind of a chilly morning, but thank you guys for making it. And I wanted to let you know, whether you stay for the keynote alone or if you stay until the end of the day, I hope you all leave today feeling a little bit more enlightened on the topic of refugee health. That's our main goal to get across to you guys today. And we're excited to have such a diverse group of people today, so make sure to turn to your neighbor, introduce yourself, because we have people from different states, different colleges, different schools, so we hope you all enjoy the conference. And so now I'd like to introduce Dr. Deborah German, who is the Dean of the UCF College of Medicine. And Dr. German earned her MD degree at Harvard Medical School. She did her residency at Strong Memorial Hospital in Rochester, New York, and then her fellowship in rheumatic and genetic diseases at Duke University in Durham, North Carolina. She has been recognized by many communities and organizations for her leadership, patient care, and community service. Dean German?
Well, my job is to welcome you here today, so let me just start off by saying welcome to the UCF College of Medicine in our new medical city. And this is an emerging center for medical education, research, and patient care. And what you see here today is really a testament to the power of partnership and the fact that we can always do more together than we can do alone. And I think the previous welcomers have said that in thanking the many people that have made this possible. And you here in the audience today exemplify the collaborative spirit as you participate in our third annual Global Health Conference, today dedicated to refugee health. As people devoted to health care, we know that we cannot care for the one unless we also care for the many, or for the all. And to be a healthy community, we must ensure that the weakest and the most in need receive compassionate and quality care. As tomorrow's healthcare leaders, you will be caring for patients in an increasingly smaller global community. Whether you serve patients overseas or practice medicine in your hometown, you will see patients from all over the globe whose life experiences are drastically different from your own. Cultural competency and global health are a critical part of the education of today's doctor, and it's one of the reasons that I am very pleased to be here today and to have this growing piece of the UCF College of Medicine program. So for all of you from other states. I know that much of southeastern U.S. is represented here. I want to welcome you to the state that we call the Sunshine State. And I think that maybe as I was driving in today, I thought to myself, you can't really even see the VA, which is right next to the medical school, when you're standing in the medical school parking lot. And I thought maybe we're trying to have a heavenly atmosphere here. You know, we're in the clouds, and by noon, the sun will be out, and you'll see exactly what we have in mind. But the good news, if you were from the north, I would say this is winter. This is winter. This is a blizzard here in Florida. But anyway, welcome. Today, both inside and outside of our education facility, you're going to learn about the healthcare challenges that are faced by refugees who arrive in our country. And you'll see how their experiences such as poverty, war, malnutrition, and other things impacts their health. And you will learn how to care for them. Your day today is really made possible by the Diebel Legacy Fund. And I would like to ask the Diebel family, the Diebel group, to please stand up and let us express our gratitude to you for today. Please stand. The Diebel organization inspires us all to be good Samaritans and to serve others before caring for ourselves. So I really appreciate what you've done for our community and for our medical school. Well, I hope today's conference will be eye-opening and inspirational, and that all of you will take home from this something that you will use throughout your future. I want to thank you for being here and hope that you all will enjoy the day.
Thank you, Dean German, for your continued support for this conference. So next I would like to introduce Dr. Donald Diebel Sr., who is president of the Diebel Legacy Fund. Dr. Diebel is well known and respected in his medical specialty of OB-GYN, and he has been a strong supporter of UCF COM since its inception. The Diebel Legacy Fund at the Central Florida Foundation, along with strong support from the board and the Diebel family, has provided sponsorship for various events, including our trip to the Dominican Republic, which I went on and had an amazing eye-opening experience, as well as service speakers such as Samantha Nutt, who came here and spoke to us in November. As students, we view Dr. Diebel as a role model for service learning in our community. And so I'd like to invite him up right now. Dr. Diebel?
Thank you. Well, I can't tell you what a pleasure it is to be here. And I look around out there and see some familiar faces, folks that have been here before, and a lot of new faces. Want to say welcome to everyone. As some of you know, the Diebel Legacy Fund was founded under the name the Good Samaritan Fund, and was started in honor of my son, Dr. Don Diebel Jr., who was killed while performing a Good Samaritan act. This is the third speaker that the Legacy Fund has sponsored, and from those who have heard the previous speakers, I think we'd all agree that they've been just fascinating, thought-provoking, and truly inspiring, and there's no reason to think that this morning's talk is going to be any different. The Legacy Fund has been in Orlando for over 10 years and has had an impact, I think, in many areas, and all related to the Good Samaritan concept. Our relationship with Shepherd's Hope, which is, as you all know, is another organization that helps the medically uninsured, but our association with them resulted in the establishment of the Shepherd's Hope East Side Clinic, which was at that time the 8th clinic in the Shepherd's Hope organization, and that is now named after my son. Our more recent collaboration with the University of Central Florida College of Medicine is one in which we are really very, very pleased with. The goals and the missions of both organizations are so in tune with one another that it really is just an absolutely perfect fit. We welcome the opportunity to support the development of new physicians who share these values of the Good Samaritan, as exemplified by Dr. Diebel Jr. The students volunteer and give freely of their time to work locally at the Grace Home and internationally in the Dominican Republic. Medical students certainly have a lot to try to learn in 4 years, and to give of their precious time to serve the needs of the underserved or the unserved is really inspiring. And I think it's interesting, parenthetically, that the medical students, you all have 4 years to learn medicine. When my grandfather graduated from medical school in 1901, he also went to medical school for 4 years. And I think there's a little more to learn today, so you guys must really be smart. You're also fortunate to be in a place where your intelligence and your curiosity can really be developed and allowed to blossom under the people that you work with, like Dr. German and Dr. Sim-Sendan, who are such terrific role models and who make this possible. So I thank you all for being here and sharing your time with us, and I think we're in for a fascinating talk with Dr. Holtz. Thanks for coming.